Welcome guys to the NeuMove approach to low back pain and SI joint rehab part 2. Hopefully you guys were also able to participate in part 1 where we demonstrated some entrapment sites for the cluneal nerve. And what else did we do from there? We did some mind muscle connections where we show the difference of how it was between stretching versus contracting. If you missed that part, don't worry about it. You can still probably view it on YouTube, but if not, please, you can email me, or you can also put it on the chat for those of you who didn't partake in part 1. So today we're going to talk a little bit differently. Not differently, we're just going to take it a notch further when it comes to how I approach low back pain and SI joint pain. Before I go on, just to let you guys know who I am, for those of you who don't know who I am, my name is Dr. Andrea Saltis, and I'm a licensed physical therapist both in the state of Texas and New York. Worked with several NFL athletes, MLB, NBA, as well as professional bodybuilders and powerlifters. My career actually started with powerlifters and bodybuilders. I got into this brain-based approach, this neuro approach, for my own rehab. So some of you may know that I had a horrific motorcycle accident back in 2005, I believe. Yeah, that was 2005. Even though there's a little bit of a mistake here, it says 2003. It was actually 2005. It was after high school. And I fell off a 60-foot cliff, and that left me with a severe spinal cord injury in which I lost almost 80% of my sensation down to my legs, as well as the function of my legs. And because physicians weren't really able to help me, telling me that it's a lost cause, don't think that you're going to be able to ever walk normal again. Not walk at all, but walk normal with a limp or probably with a walker. And I said, absolutely not. That's not going to happen. And diving into neurology just brought my legs back. Now, I'm not going to go back into my whole spiel of my story, but just to let you know that because of thinking more neuro-based, more brain-based, is what led me into standing on my own 2 feet, able to run, climb mountains, do everything I want. So this is the reason why I made this into a career. And I've been a licensed therapist now for almost about 17 to 18 years now. Wow, I'm getting old. Hopefully I still have hair now, which I just put some new implants in just a little while ago. So moving on from there. Now, before we go into some of today's exercise that we're going to be talking about, I do want to make one little special offer for you. I just want to say from now that if you are interested into what I teach, which is the NeuMove Mentorship Program. The NeuMove Mentorship Program is a total of 12 modules, which is 12 months long. So we're talking about a year-long process. It's actually now becoming more of a 13 to a 14-month process because I'm just constantly adding more and more material. Anywhere between visceral therapy, vestibular therapy, respiratory, muscle skeletal, proprioception, mind muscle connections, cranial nerves, everything that has to do with every system of the body. This is what I teach because I had to learn every system of the body in order for me to be able to stand and walk again. And that is the approach that every physical therapist, chiropractor, physician, osteopath, personal trainers, or even fitness enthusiasts, they have to understand that we're made up of systems. We're not made of just biomechanics, muscles, bones, joints. We're made out of a visceral system, a cardiovascular system, a vestibular system, a visual system. Today I'm wearing my blue light blocking glasses. These are not prescription. Don't think that I'm wearing prescription glasses. I have pretty good vision. So teaching all of this is what I formed in my NeuMove Mentorship Program. And the enrollment now is going to end by the end of this month, by June 30th. And what I have for you guys, for all of you who are physical therapists, chiropractors, osteopaths, or even just your simple fitness enthusiast, you don't have to be a practitioner to understand what I teach. I make it so simplified that you're able to understand and be able to explain it to a 4-year-old. And one little small deal that I have for you guys, if you're interested, I'm also offering for 1 month for just $50 that you can take the first 2 modules of my mentorship program, so you can look at it, study it, and you're going to get a live coaching call with me, so you can ask your questions, talk about your patients that you need help with. So for 1 month, you're going to have me, you're going to have the first 2 modules of this mentorship course. So this way you guys can see what I present, what I teach, the amount of research that I have in there. There's not a single module in my mentorship that I don't have a research archive. I'm not just talking right out of my ass, right? And then you're going to decide from there after a month if this is the right fit for you. And the beauty about this is that it is refundable. I'll give you your $50 back if you're like, damn, bro, this ain't for me. Okay, no problem. Thanks for joining in, right? So hopefully you guys like this little deal for you, that you're going to have this access. And obviously the $50 will be waived off from if you're looking into partaking into this mentorship program. So now, enough about this. I'm going to explain it a lot further at the very end. Let's get started with some of the material that we're going to be working with today. So we're going to start off with position-specific isometric loading. Now, the reason why I say position-specific, I do not treat people on tables. In life, we're not laying down, everything's nice, and I'm expecting some guy to rub me down, or some girl, whatever, and thinking that I'm going to feel a lot better. It doesn't work that way. I have to put you in the positions that you normally hurt and rehab you there, because that is true appropriate rehab. I don't have any patient on tables. I have them standing, I have them walking, doing activities. So that's what I care about. It has to be specific, position specific, and we're going to load it with isometrics. So I'm going to later on call up my model, and we're going to practice a few positions, foot positions, pelvic positions, to see what positions, if you are suffering from lower back pain and SI joint pain, we're going to find very comfortable positions for your brain to feel that, hey, this is safe for me to bend over with no pain, right? If, for example, you have pain on your lower back or your SI joint and you're feeling pain with bending forward or backward or side bending, then I'm going to find comfortable leg positions and pelvic positions to make that more comfortable and strengthen you there, right? I'm going to demonstrate soon. We're going to test out basic movements: flexion of the lumbar spine, extension of the lumbar spine, rotation, and side bending, right? Basic active range of motion stuff to see, does that produce, in which any of these movements, produce pain, right? So the first step that you're going to be doing is assess, then vary the base. So I'm going to assess the movements. For example, a baseline, normal standing stance, normal standing, right? Test flexion, test rotation, extension, side bending, note, and take note which direction, extending, bending forward, side bending, turning, which one of those gives you pain, right? That becomes the movement you're going to test and retest, right? So we're going to start off with, let's see what happens if you're just fully erect with knees extended. Test everything. It hurts this way. Okay. Try it now with knees bent. Retest. Try it now with toes in. Retest. Toes out. Retest. Then we're going to see maybe one foot needs to be pointing out, the other foot needs to be pointing in, or vice versa. And then we're going to see it in different split stances as well. So we're just trying to find comfortable positions for the athlete or for yourself to feel more comfortable with almost no pain, to allow you to do that movement without any pain. Hopefully that makes sense. We can take it a notch further to see what happens if we do it with eyes closed or versus eyes open, right? I may need to do some perturbations. That's some progressive stuff, which if I have time, I'll explain. So that's going to be step number 1. Find the appropriate foot position and knee position and hip position. See which one gives you the best relief, right? And then we have step 2. Step 2 is now looking at the pelvis. Do I need to, as I have my toes inverted and knees bent, and that made me feel good. Let's see what happens if you do a posterior tilt. Retest. Let's see if you do an anterior tilt. Retest. What happens if you do a lateral tilt? Retest. So we're looking at ankles, knees, hips, and pelvis to see if that gives us additional range of motion as well as minimize the pain. And that is the position I'm going to take my athlete with lower back pain or SI joint pain to strengthen them there, preferably with isometrics. Now, load the trunk with isometrics. Now, we have two different kinds of isometrics. Now, the reason why I like to apply isometrics, it is literally the safest form of strengthening because you're not moving. You can get bigger muscles. You can promote hypertrophy if you want to. But isometrics have also been shown to reduce pain dramatically. It's just what type of isometric is required, how long it is required, which direction, and do I need, just like you guys see here on this PowerPoint, do I need yielding isometrics or do I need overcoming isometrics? Yielding isometrics is the coach tries to move the client resists and holds the position. Train position-specific control and endurance. Can you keep the comfortable posture under load? Basically, what yielding isometric means is if I have my athlete doing an isometric, right? And my command to that athlete is, as they're doing the isometric, and I'm giving the resistance, I'm the one now giving the resistance for the isometric. A yielding isometric is more of a verbal command saying to my patient, don't let me beat you, don't let me beat you. That in turn becomes, in other words, a eccentric isometric, right? We have concentric, eccentric. So it becomes like an eccentric isometric. If I tell my athlete, don't let me beat you, don't let me beat you, don't let me beat you, that becomes a yielding isometric. If now I say something different and I tell my athlete, try and beat me, keep beating me, keep pushing, that now becomes a overcoming isometric. Both types of isometrics will give me a different response to the patient's low back pain and range of motion, right? So you see, it's nice to say that we're going to do isometrics, but there's a lot more when it comes to what type, the time, the intensity, all of that stuff matters, right? So that's going to be our version of isometrics and our appropriate positions. Reassess after each type of isometric, either a yielding isometric or an overcoming isometric. Keep the mode that improves comfort and control the target direction, then progress the load, range, and complexity. All right. So now let's just go back to one more. Now we have bone conduction headphones next. We're going to stop right here. So let's just review before I call in my athlete here. We said we're going to have your athlete, even yourselves, for any one of you that are watching this right now. First, I want you to stand nice and relaxed. You're going to check side bending. Even if there's no pain, see which side feels stiffer. Check forward bending and backward bending. Check maybe rotations, right? Do a little bit of a pain/stiffness scan, right? And then follow me what I'm about to do with my athlete. I'm then going to position her in specific foot and hip positions and pelvic positions to see which one gave her the best. And then I'm going to move on into strengthening that gave me the best range of motion. Hopefully that makes sense. So now, from here, now let's shift on to calling out one of my favorite athletes and the beautiful athlete, Laura. What's going on?
Hello,
Thank you
hello.
so much. All right, guys, we have Laura again. So if you guys remember, we had Laura on part 1 of the low back, and she did experience some right-sided SI joint pain. And if you guys remember that we did tape the area, which we found the entrapment site for the cluneal nerve. Now, literally last night, we were just watching TV and we're literally about to fall asleep. She was already falling asleep. She's kind of like shaking and everything. I just love it. Like a little spasm. And then I'm like, babe, I just realized something else. She goes, what? I'm like, didn't you say that you also had a herniated disc around L5S1, right? And she goes, yeah. I'm like, okay, because I know that Laura she doesn't experience, thank God, no more lower back pain, but she is experiencing quite a long time now some bilateral hamstring pain, upper hamstring pain. And I'm like, all right, this is bilateral. And when I hear people that have bilateral issues, my mind goes now to the midline, the spine itself. If she would have told me I just have pain only on my left leg, I'm like, all right, that might be just a peripheral nerve, a sciatic nerve going down her left leg, right? But she's complaining to me about both. So both sciatic nerves are being affected. And when both are hurting, I'm thinking now, this is a spinal cord problem, kind of like the thing that I had, right? And we looked at her scans. Now, I am not a fan of looking at MRIs. To be honest, they're pretty much trash, okay? Because it doesn't tell me a definite diagnosis, right? It's just a picture of you sitting still. It doesn't give me enough information for me to go about saying that this is the source of your pain. But I say, you know what? I remember that we taped your lower back on the right side, and your lower back felt better. Let's see if we can move it a little bit more centrally, because her herniated disc was a central herniation, not to the right, not to the left. And I'm like, let's just see what happens here, right? So I had her do a forward bend test, even though she was ridiculously tired. And she's like, are we really going to do this? I'm like, yeah, we're going to do this right now. I got to show this to people. So what we're going to do right now is going to do a range of motion test for her lower back. Again, we're looking at to see if we have any low back issues. But you might also have maybe some glute pain. Maybe you might have some hamstring pain, right? It's the same process I will do for somebody that has one-legged problems or both-legged problems. So let's test out Laura's range of motion pain levels. We're also going to check out a little bit of her hamstrings, even though they require a little bit more work. And I did find some stuff also with her vision that we did that gave her the best benefit. Hopefully, if I have a little bit of time, I can go over that today. But if we don't, you might want to join me on the mentorship program so you can see how I do eye work with her. That gave her the best benefit out of everything that I've ever done with her. Is that true?
Yeah, absolutely.
All right.
Just
All
work
right.
on the eyes.
So Laura, what are we feeling today? You feeling any kind of low back pain?
No pain, just some bilateral stiffness, tension in the hamstring, particularly the left.
Particularly the left.
Both,
Okay.
but definitely more so left.
Okay. All right. So now let's try some range of motion stuff.
Okay.
Let's see if you can just face forward to the camera. Is this central? Is it pretty good? All right. So give me a side bend to the right, to the left. Let me know if there's any discomfort on any one of those.
More tension.
More to the right. And I can see it's more limited that
on
way.
the left.
Yeah.
Yeah.
So, oh yeah, last time we taped your left side, if I remember. Or was it the right side?
Right.
It was the right side. Now today she's feeling it on the left. Hey. All right, so we
I love
saw that. Notice her range of motion. Let's try that again. Let's go to the left. Notice that range of motion that she has. And when it comes to the right, that's limited,
really gross.
right? And she's feeling a pull on her left side, not on her right. Let's check now. Let's see rotations. So hands out. When I check rotations, I have people with feet about shoulder width apart. I would say keep knees locked out.
Okay.
And I check their range of motion. Their head is going to turn with them. Their hips can turn with them, but they don't take their feet off the ground. So let's see. That's to the right. And let's see the left. Let's try one more time. Okay. Looks a tad limited to the left from my view, right? So a little limited to her left. All right. So we got that information. Was there pain with that?
No pain.
No. Just more like a stiffness, right?
Yeah.
Okay.
Yeah.
Now the big one. How about we face that way so we can get a side view? I don't really like to do toe touching as an assessment because there's a lot of vestibular stimuli involved with this, but we're going to go slow just to see if she feels any kind of discomfort on her hamstrings and especially her lower back. Ready for this?
Yes.
All right, let's give it a shot. Nice and slow. Honestly, I wish I could do that. How did that feel?
Tightness started to show up at the ischial tuberosity on left and right, particularly left.
Particularly the left.
Yes.
Okay. Comparatively to yesterday, is it still the same intensity?
It's better.
It's much better?
Yes.
All right. We actually did some, like we said, we did some of the vision work, and it's a lot better today, which is awesome. But still, there's something there I want to get rid of. Let's also test your extension. Not bad. Any discomfort there?
No discomfort.
No?
Nope.
All right. So now, let's start the process. So we saw everything now with her knees extended, feet in neutral. Now let's start this process by check your side bending again with, wait.
Oh.
With a little bit of bending on the knees.
Okay.
Tell me if that makes it easier or worse.
Makes it easier. Easier, especially for that left side.
Did it help?
Yeah.
It helped, right?
Yeah.
Okay.
Just for bend.
So far, we know that with knees bent, eases up the pain. Check, keep the knees bent, and you can do it this way. Do a toe touch. Let me know if that creates obviously a lot less tension on the hamstrings.
Still feel that left.
Okay. Comparatively low, though, to a knees extended, was it different or the same?
It was actually more with the bent knee.
It was more with the bent knee. Okay. But the side bend did improve.
Yeah.
Okay. Let's keep both knees bent, and let's go with both toes inverted. Internal rotation of the hips now. Let's reassess side bending again. Not good?
No.
No? Just for craps, why don't we check the forward bend? Let me know if that got any worse too with the knee bends. Yep.
Yeah. Doesn't
Not
like
good?
that. Doesn't
Okay.
like that.
Let's go toes out.
Okay.
And knees bent.
Toes out. Knees bent.
Yeah. How was that?
That's good.
Better?
I like that.
Toe touch?
Yeah.
Better, right?
Yeah.
Okay.
Better.
Now let's get even more specific. Let's keep the left foot pointing out, but the right foot pointing in. Knees bent, still body facing straight towards the camera. Let's check that one now.
It feels tighter.
Tighter?
On both sides.
Okay, let's switch. Right foot out, left foot in. Put your right foot out, put your left foot in.
Okey pokey. Ooh, that one's good.
That was good?
Yeah. I like
Toe
that
touch?
one. Toe touch.
Knees bent, watch that left.
Okay.
There we go. That looks
Oh
nice.
my gosh.
That looks really nice.
Night and day.
Perfect.
Night
See
and
what
day
happens when you change positions.
Yeah.
So now we took care of the foot position, the knee position, and the hip position.
Wow.
Now let's go to the pelvis. Pelvis, let's try
Straight
with a light posterior tilt. Oh, I want you in the same stance.
Okay.
But now I want a light little tuck.
Okay.
Very small. Okay. A little posterior tilt and recheck that. Better, worse, or same?
Much better.
Much better.
Yes.
Just for craps, why don't you do an anterior tilt?
Oh. Nope.
No. Okay. So a posterior tilt is a winner.
Yep.
Let's also check with feet the same way, little posterior tilt. Let's try maybe a lateral tilt. Let's get the right pelvic bone up. Right there. Very small.
Okay.
Check that as well.
No.
No?
No.
Just do the left then. So hike up the left. Very good. And check that now. That should be better.
Oh, wow. No.
The best one so far, right?
Wow. Yeah.
Try your hardest to keep that as you do a toe touch again. I know it's hard.
Oh my God.
Bingo. Oh my God. Hey, what's up?
No pain. No pain. Yeah. Hello.
There you go, guys. Wow. That is the most comfortable position for Laura. For you, it might be different, right? So we found right foot out, left foot in. How does it go?
Shake it all about.
Shake it all about. Right. So right foot out, left foot in, knees bent, posture tilt,
left hip hike.
A left hip hike,
yep.
right?
Yes.
And we're just going to keep it there. Okay. Now we're going to do our isometrics. Now with isometrics, let's do this actually in a neutral stance.
Okay.
Let's recheck your rotations. Okay. All right. Okay. Still stiff, or did it get a little bit better?
Got a little better.
Got a little bit better, right? Just by positioning her, she got even better.
Yeah.
But now, I know she's limited mostly to her left. I'm going to focus a little bit more on her left rotation. Left rotation, what muscles do that? Usually the left erectors and the right abdominals. Rotate the trunk left. Conversely, rotating to the right, it's right erectors, left abdominals. So we're going to try a isometric, more like in a Pavlov press. So she's going to have her arms out. And we're just going to do about 8 seconds of her doing an isometric. And I'm going to first start with a overcoming isometric. Let's do it in the position that we found. Right foot out, left foot in, knees bent, little posterior tilt with a hip hike on left. Arms straight out. So now, I'm going to give her the resistance. From here, she's going to push. And now I'm going to give her the verbal command, don't let me beat you. Don't let me beat you. Don't let me beat you. Come on, don't let me beat you. Come on, don't let me beat you. Don't let me beat you. 5, 4, don't let me beat you. 3, 2, 1, break. You okay?
Yeah.
Did you feel the engagement on the erectors?
Oh, yes.
Very good.
Oh, yes.
Now, normal stance. Let's check your rotations again.
Wow.
That one got better.
Oh my gosh.
That's way better.
Hello.
What's up?
All the way around.
I don't know about this, but check your forward bend. Let me know if that changed anything.
Neutral. Okay. Yeah.
Better?
Yes.
That was it. So this time she did it with a normal stance. I didn't have to put her in positions to recheck. So that reduced the pain. Pretty good. Let's see what happens with overcoming isometrics. Same position. Right foot out, left foot in, knees bent, hike left, posterior tilt. That's a posterior tilt, right?
Yep.
There we go. Now, overcoming is push and keep beating me. Keep pushing out, keep pushing out. Good. Keep beating me. Keep beating me. Let's do this. Keep pushing. Keep pushing. And keep pushing me. Break. Awesome. All right. Breaking up a sweat here. All right, girl. Let's check again. Rotations. Nope. Not as good, right?
Yeah, not as good.
Not as good. Check your side bends again. We didn't check that one before, but check side bending. Not the best.
No.
Nope. Toe touch.
No.
Nope.
Oh, I mean, the right one popped.
The right one's talking now.
More so, yeah.
You see what happens, guys? You have to be specific with your isometrics, even that. So we're going to do the yielding again one more time. If you guys are doing this at home, for a yielding isometric, it's best to hold a resistance band. Let's say it's hooked somewhere to your side, and you're holding a resistance band. The resistance band wants to pull you back towards the band. So it's kind of a yielding isometric already. For me to do overcoming, either I'm going to need like a TRX strap, which is nothing elastic, there's no give, or I'm going to say this in my New York accent, you can use a wall, right? I forget that I'm a New Yorker. So you can literally push against the wall or the door frame to do an overcoming isometric if the overcoming isometric was the one that helped you the most. So back to Laura now. Let's fix her up because I don't want to leave her messed up. Can you turn that left foot a lot more in? Much better. Okay, so here we go. Arms out. Have left hip hike. Very good. So now, ready for this? And push. Don't let me beat you. Don't let me beat you. Don't let me beat you. Good. Breathe, breathe. Don't let me beat you. Don't let me beat you. Don't let me beat you. I'm beating you here. And break. All right. Relax a little bit. Shake off some tension. And let's check the side bends first. Yes. Question. Yes.
Yeah. Great.
When hiking up the lane, you keep the full bottom of the foot on the floor?
Yes.
Yes.
Yes. Yes. When you're hiking up the hip,
Right.
notice that her foot, can you guys see her feet as well? Yep. Notice that the foot stays on the ground. Now, a lot of you have probably a little bit of a hard time knowing how to hike up a hip. I get it. It's a skill to learn. This is what I teach in my mentorship course. So to make it easier for you guys, the more the knees are bent, the easier you're able to hike up your hips, right? So you're doing lateral tilts, posterior tilt, anterior tilt. That becomes then a circle, kind of looking like Shakira. Shakira's got nothing on me. But the feet have to stay on the ground. Yes. Okay. So we were testing side bends.
Which were much better.
Much better.
Yeah.
Rotations?
Smooth.
Very good.
Wow, that's the best one on the right.
Hey.
That's unbelievable.
All right. All right. And the big one, toe touch. Love it.
Wow.
How did the right feel as well?
Right was great.
Right was great.
Just a tiny bit
Still a little bit on the left though, right?
Mm-hmm.
Okay. So now we're kind of done with the isometric and positional part. I did want to mention, since we spoke about with Laura yesterday about her central herniation, I know that she has one little additional threat on her lumbar spine. I want to go to that herniation and retape it. So because our job is to minimize as much threat to the brain as possible. Her threat, number one, was not good hip position. Another threat is a past herniation, right? It can be a threat. It cannot be a threat. But I'll still do something to that L5S1 just to see if it reduces pain, meaning reducing the threat even more, right? Additional threats that Laura specifically has, even though you look gorgeous, everything's great. There are some vestibular problems and visual problems with Laura that, like I mentioned before, they gave her the best benefit out of everything that we've done. That's why we're going to do bone conduction headphones next. Yeah. But I do want to retape her lower back in a specific direction to make it even more comfortable with her. Can you turn around? Let's face that way. So if you guys now remember, do you mind if I pull this up a little bit? So when it comes to, am I okay if I kneel down? Good. So now we have L5S1. To find L5S1, we said you go to the edges of the pelvis, right? The iliac crest. So here's the iliac crest, the top of the pelvis, a straight horizontal line. That now is your L5. So we're looking at a distance between L5 and lower, because she did have something on L5, S1, and S2. S2, which is sacral 2. So I'm looking at this junction right here. Okay. So now I'm going to test out first her neck, even from this position. Arms down for now, though. And now, can you check your neck, bending left and right, side bending? Let me know if one side's tighter than the other.
Tight. Right side's tighter.
Right side is tighter? Let's check rotations. Neck rotations, sorry. Right side? Yeah. Let's check your right shoulder internal, external rotation.
Internal, what do you want me to do?
Yeah, internal, external.
Oh, okay. Yep, that's right.
There, let's see the left. Anyone felt tighter than the other? Pretty
Equal.
good? Okay. Let's check trunk side bending. Still pretty good than before, or did it tighten up?
No, feels good.
Still good?
Yeah.
And let's check your trunk rotations as well. Rotation got a little bit limited to the left. Okay.
Mhm.
And let's do a forward bend, but let's turn around, facing the camera,
Okay.
so we can keep some modesty going on. All right. So now left one still talking a little bit?
A little bit.
A little bit? Okay.
Mhm.
Let's turn back that way. So now I'm going to go to her L5, S1, and S2. And I'm going to feel now centrally skin drags. I just pull the skin up, pull it down, pull it left, pull it right, and I'm trying to feel which one of those 4 directions the skin feels a little tighter. So let me just assess here. So downward feels a little more limited. Left. And I'm feeling some restriction to her right and down. So now I'm going to pull the skin downward to see what that does. Let's see neck side bending first. Better or worse, you're saying?
A little better.
A little bit better?
Mhm.
Head rotations?
Much better.
Okay. Trunk side bends?
Really good.
Really good.
Really good. Yeah.
Trunk rotations?
Yeah.
Look
Really
a
good.
little
Yeah.
bit,
Yeah.
right?
Okay.
And the big guy, let's check. Well, yeah, let's turn around again. Sorry. And let's check your forward bend.
Yeah. Yeah.
A little bit better?
A little bit better.
Okay. Let's turn around again. So now I found a downward direction, gave me some good results. Let's get more specific. Do I need straight down to the left, or down to the right? I found specifically she had the most restriction down into her right. So I'm going to keep it that way. Yeah, there. Let's check that neck again, side bending.
Oh, yeah.
That's the best one, right?
Mhm.
Yep. Rotations there and there.
Oh, good.
Still good, right?
Mhm.
Trunk rotations.
Whoa.
Bingo. All right.
Yeah.
And turn around again. Let's just do the forward. All right, there. And let's go. Yeah.
Oh, good.
That's really good.
Yeah.
Right?
Yeah.
Okay. Now, just to show you guys something really quick, if I pull in the opposite direction,
Mm.
up and left, check your neck again.
Oh.
Tighter?
Yeah.
Head turns?
Ugh.
All right. And let's just do trunk rotation.
Oh.
Nope.
Nope.
Notice how tighter that got, right?
Oh my God. It's like that much difference. It's like 1.5 feet.
All right. And do that trunk rotation again. I'm going to pull it down and right one more time. There we go.
Oh my gosh.
Yep.
Wow.
And that's it.
Wow.
You see, guys, just tissue, just skin, right? I'm not going to get into the whole neurology of it yet. We're going to be here all day, but that is the direction I need to be placing kinesio tapes to maintain that result. Let's turn around. Now we're going to tape this up. I got 2 ones from Rock Tape. Again, I'm not sponsored by them. I just really love them because they really do stick well with this. So to know how we do our tape job, right? We have cut the paper in the middle, take 1/2 off, place that. In Laura's case, I placed that now on her L5S1. And what I do now, I don't pull from this end. I push the tissues down and right, in Laura's case, and then, yeah, a little bit down for me, thank you. And then, again, one hand pushes down and right. Then I take this remaining tape, a light little stretch, about 50 to 60%, and I apply that on. And I'm going to put one more just to get that S2 junction. So I kind of overlap it. Same exact way, I push. And come on. I stretch the remaining tape the other end, a good 50 to 60%, and I got that right there. Now, all I ask from the athlete and for Laura is to go take a walk, but come back. All right, a little bit of walk, just to let the kinesio tape work. No foot position or anything. Let's see if just the tape alone did anything itself. Let's check side bends of the neck. Yo.
Wow.
Stroke rotate, neck. Perfect. There we go. There we go. All right. And trunk side bends as well. And then a toe touch one final time. How's that?
It's like butter. I don't
Like
know
butter?
how else to describe it.
All right. You guys were good on her microphone, right? Yep. And toe touch. Let's see what that did. Still very, very good. All right.
Wow.
Perfect. So that was awesome. We're good for now. I'll call you back a little bit later, right? So now, from here, guys, hopefully that made sense when it came to how I tape the area, which I also covered that in part 1. But you guys do see now, you can have low back pain or SI joint pain, regardless of what an MRI says, regardless of which muscle it may be, whatever, right? Still though, you can self-treat yourself. This is why I kind of have a pretty successful online business, because I do this stuff. Find a comfortable foot position, knee position, pelvic position, whichever one helped you the most. Now test out which isometrics do I need. Now in Laura's case, what I would usually also do is I would give her a yielding isometric in the Palloff press. I know that she's mostly hurting specifically with a forward bend, right? So ideally, I would have to put her in that forward bend position with the foot out and the hip hike. I have to position her that low because I have to be specific. It's what we call the SAID principle, specific adaptation to impose demand. I have to position my athlete in that position that they hurt, but now they're not hurting because I altered their foot positions, and I have to strengthen them there, right? Because Laura and yourselves, you might gain a lot more range of motion, but you don't get to keep it. You have to strengthen it now. And the last part I will say with this one, before we go into bone conduction headphones, is I don't just do only that direction. I have to do multiple. I have to do an isometric to the left, to the right, up, down, maybe some diagonals. I have to strengthen now Laura in multiple directions of isometrics in order for me to have a much more longer lasting result, which we're going to do that after once we now stack bone conduction headphones. All right. So hopefully you guys enjoyed this. This is not just only for what Laura presents to me today. This is for every kind of low back case, right? Whether you have a, what we call a sciatica or just gluteal pain or any other kind of pain in the lumbar spine, I would still do the exact same process. In all kinds of cases, I tend to do this first, right? Because I want to make sure that I give my athletes, or I give their brains, that it feels safe to do their original painful movement, to make it a lot more comfortable for them, because I want their brains to kind of calm down and not to feel so much threat. I want them to know what it's like. Hey, I remember what it was like to bend over without pain, right? But now I can't do it in this stance. But if I alter your stance and make it a lot more comfortable, your brain now remembers, hey, now I know what it was like to bend that far with no pain. So it works with every case. That was a very good question. So we're going to pause right here on the isometrics. We're going to return back to them again at the very end. Now, let's go on to the next chapter. We're going to go on to now bone conduction headphones. Now, bone conduction headphones and the saccule. The saccule is part of your vestibular system. So we're going to talk a little bit about the vestibular system, which is your natural GPS system. It tells you two things: where I am and where am I going. It's responsible for knowing that I'm upright against gravity. Specifically the saccule. We're going to talk a little bit about the anatomy. Two things. It tells you which way is up and which way am I going. Am I going to the right? Am I going to the left? Am I going back? Whatever, right? So now bone conduction headphones, I'll explain what these are. And the saccule, it's a portion of the vestibular system that the bone conduction headphones stimulate the most, right? It's a field expedient way to screen the saccule, a tap into postural tone. So now, let's talk a little bit about the anatomy of the vestibular system. We have what we call the semicircular canals. If you look at how they look like anatomically inside your head, they kind of look like this: projections forward, upward, and horizontal. The semicircular canals are responsible mostly for angular motion of your neck. Rotations of my neck, down, back, up, right, down, left. So the semicircular canals are responsible for head position in space to maintain balance, right? Then we have what we call the otoliths, which is not written here, but they're comprised of what you guys can see here on the PowerPoint. You see the utricle, which is responsible for linear motion. And then we have the saccule, which I don't think I have it on there. It's okay. The saccule is right next to the utricle. The saccule, I'll explain in the next slide. There it is. Saccule, wow, in big red. The saccule is going to be today's focus, right? So we have semicircular canals. Right next to the semicircular canals, we have what we call the otoliths, which are comprised of the utricle and the saccule. And then you have the nerve, which is the vestibular nerve, which goes into your brainstem, right? Your brainstem controls everything autonomic: your heart rate, your blood pressure, and your breathing. And it also controls your posture. Posture lives in your brainstem, not in your muscles. All right? Your vestibular system is directly into the brainstem. So it makes sense to use these guys to help fix your posture, right? Let's now go a little bit deeper into what the saccule does. We said that the semicircular canals, angular rotational head movements. Then we have the utricles, which is horizontal linear motion and head tilting. So utricles they're stimulated by me walking forward, me walking backward, me walking side to side, and tilting, right? So if I know I have Laura, or any Laura, that has some neck pain with tilting, has some neck pain or back pain, the more they walk forward, I got to look at the utricles now. If she were to tell me I feel pain also now with squatting, which is exactly how she got injured. She also did experience recently some left plantar fasciitis. And the way that happened, she was in a motorized treadmill, not those woodway ones, those curved ones that you actually have to drag the treadmill, which those are better. They're better. They're not the best. Best is running outside. But if you're running on an electronic treadmill, which Laura did, you're not running, you're hopping. And she was gunning it, right? I could see her from the far end of the gym. I'm like, wow. And then she comes off. And then she said, the moment I came off, I felt a little dizzy. It felt like the floor was a little unstable. Few steps later, heel pain. And I'm like, how many things do I have to fix on you? Seriously, just stop. But anyway, comes to me with heel pain, nagging heel pain. And I tried doing some stuff on her heel. Things did work. Vibration helped a lot. Everything helped. But I'm like, hold on, how did you get injured? She goes, on the treadmill. Oh, okay. So the treadmill, you're not running, you're hopping. So it's a lot of up and down. And you're trying to do an activity, running, that requires you to go forward, but she's staying in place. So now this is a sacral problem, right? And a utricle too. The reason why I say it's also a utricle problem is because she also suffers a little bit from motion sickness, right? Oh, the things I have to think about here. So anyway, let's go to the sacral. The sacral is responsible for vertical motion, elevators, squatting, jumping. So anything up and down, sacrals. Moving forward, back, and side to side, and tilting, utricles. Head rotations, semicircular canals. So when it comes to the sacral, which is where we're going to be using the bone conduction headphones, is where it says here on the PowerPoint, macular orientation roughly vertically. It just anatomically, it looks like a vertical little organ. Retains acoustic vibratory sensitivity tuned to low frequency inputs approximately up to 500 hertz. These are what the bone conduction headphones do. They vibrate. And the sacral loves vibration. And the sacculocolic pathway, it's the pathway from the sacral to neck musculature, specifically the SCM. I don't want to dive into it, but when researchers checked or they researched how the bone conduction headphones affect the vestibular system, they're very easy way to test out what impact that did, not only to up and down, but they test out the SCMs. They mainly checked head rotations, flexion, extension, as well as vertical movements. And they saw that when they had the bone conduction headphones sound of the frequency on one ear, the SCM got a lot looser. Or if they manipulated the frequency, it got a lot tighter. So that's a totally different topic. I don't want you guys to get confused and get lost into the detail. Don't worry about that. You guys are going to understand a lot better once I have this in the practical portion. Now, few last things about the sacral. Why the sacral hears. Phylogenetically, the sacral is close tied to the ear sound, detecting organs and retains sensitivity to vibration. It is preferentially activated by low-frequency vibration sound with tone near 500 hertz. We're going to be testing out some frequencies here. Bone-conducted vibration travels through the temporal bone and excites the sacral macula directly. So there's just vibrates the temporal bone. You guys don't need to know this about the sacculocolic pathway. That is basically the pathway from the bone conduction. Where does it go? Which nerve it innervates? It stimulates the temporal bone. Then after the temporal bone, it goes to the saccular macula. Then it goes to the inferior vestibular nerve. The nerve then attaches to the vestibular nuclei onto the brainstem. And then you have the SCM measured by a specific testing that the researchers did that they called the CVEMP. You don't have to know this, guys. I'm just putting this out there for those who are physicians or physical therapists that need to know a little bit about the anatomy of certain things. Let's get right into the actual bone conduction headphones. Now, why bone conduction? Like I mentioned, there's no field expedient sacral test, meaning there's no functional test out there, right? Until now. The sacral has no quick bedside screen, so we use an inexpensive workaround. These headphones cost maybe $130. That's it. And you can easily find them on Target, believe it or not. And the funny thing is that the creators of these bone conduction headphones didn't realize how really, really therapeutic they can be to neck pain, to back pain, to almost any kind of pain. Borrow bone conduction sound through the skull, stimulates the sacral directly bypassing air conduction, so it doesn't go inside your ear. It sits right behind it, as you guys can see on the picture on the right-hand side. And then last, it drives a measurable reflex. Clinically tested with a CVEMP, cervical vestibular evoked myogenic potential. It's just a measurement. Now, I like to hope that most of you guys do have these bone conduction headphones. To get more specific, this is the app that you're gonna download on your iPhones. This is the only problem I have. I'm not an iPhone guy. I'm a Android Galaxy guy, just because I'm awesome and I like to make fun of iPhone users. I really don't want to be that part of the cult. But I had to borrow some of my iPads so I can be able to pair it with the bone conduction headphones. So if you have an iPhone, preferably an iPhone, you're going to download the Function Generator Pro on your Apple Store, right? It's Audio Function Generator Pro, and that's how it looks like. The headphones are the Shocks, specifically the Open Run Pro. Shocks, SHOKZ, Open Run Pro. There's now an Open Run Pro 2. It does the same thing. It's just $30 more expensive. You don't really need to get that. Just get the first one. Shocks Open Run Pro. Yes. The settings now is more when it comes to this. So now we're going to be playing with a couple of settings here on the app. So if you guys have here, actually I'm going to bring mine. Now, when you have your app, you're going to see a screen like this. At the very top, you have a frequency. On the bottom, you have a wave of the sound. And I tend to pick the second one, which kind of looks like a square, right? And then the only last thing I need to adjust here is now the BPM. There's 3 letters down here, BPM, beats per minute. I set the BPM accordingly to the athlete's resting heart rate, right? So if I know Laura's resting heart rate is at 60, I keep it at 60. So now, when it comes to the frequency at the very top, I'm going to start at 100 hertz. And I'm going to make sure that she can hear the sound on both ears first. So I play the sound, I retest. Then I pump it up to 200 hertz, retest. 300 hertz, retest. 400, retest. So I'm going to be testing by hundreds to see which one gave her the most range of motion and relief. Then I'm going to test out which ear does she need that now the most. Does she need it on her left ear only or on her right ear? Depending from there, I keep that setting there that gave her the best relief and range of motion. And I'm going to use that now while I'm doing the isometrics for her. Hopefully that makes sense. Yes? I'm sorry?
What do you use for your Samsung?
For my Samsung, there's an app that's called Neurally. 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 Phenomenal app. It looks a little old school, kind of looks like Craigslist kind of a thing. But that one, I love Neurally because it doesn't have only the frequency sounds, but it has other settings in there, such as vision drills, mirror box therapy features in there. It has a lot of stuff that I personally love. So I use for my bone conduction headphones, I use Neurally. I will admit though, it's still not just as good as the Function Generator Pro. It's a lot more, I like this one more because of the quality of the sound for this one. So sorry about that. I have to talk to somebody. Maybe I mean to talk to Function Generator Pro guys and be like, yo, you guys got to make something for Galaxies because we're awesome at this. Anyway, so I already have my settings preset here, 100 hertz, both left and right ear working well. The line that I picked here was the square looking one. And I'm going to call out Laura just to ask her a couple more other questions. So very good question. Do you keep the BPMs at 60, which is usually your resting heart rate, even while you're exercising? This one, a little bit more. This one, no. There are times where I tell my clients, keep it at 60. Go train. If somewhere in your training, you're starting to feel a little shitty, change your BPM. Take your heart rate really quick. And if it's like 90 or 100 or 110, put it 110. and then they start to feel better with that. I will admit, it's not a fun sound. It's just a beep, beep, beep type of sound, right? When you're training, I tend to do my set with the sound on. When during my rest periods between my sets, I usually kind of keep it shut off, so I won't get so annoyed with the sound, unless you can tolerate it. The volume also has to be loud but comfortable, right? Because we need as much vibration coming from the bone conduction headphones as possible, all right? So, as you guys can see, if you can hold that.
Yep.
These are the bone conduction headphones. Which camera am I looking at? Yeah. These are the bone conduction headphones. I can come maybe just a tad closer. You guys can see from there. That's what we have right there. Oh, yep. Good. So I don't know if we are zoomed in, but these are the bone conduction headphones, right? And they just hook on to your ears like this. See, nothing goes inside the ear. It's beside it, right? When you guys get this, there's two different sizes. One is the normal size, and there's a mini. Usually women, small heads, big brains. This should fit very well. You have to make sure that the back parts of the bone conduction headphones are sitting well on the back on the mastoids. Usually these come with a band that you can put around, like a little headband, to make sure that these are nicely touching against the bone of the mastoids. If they're coming too far out, you're not going to get a good response. Hopefully that makes sense. Let's put these bad boys on. Are they on?
About to be.
Yep, they're pretty on.
Okay.
All right. So now, first, let me know if you hear anything.
Yeah.
All right. Now I have them off. Let's reassess everything again. Now, from here, let's check again. Let's just make sure that they're nicely tight. Okay, so we're not... All right, we're going to... For now, they're not touching the back. I would say, see if you can keep the back parts of the headphones.
Yep.
With your hands, just allow them to touch. Okay. But since we're testing now with no sound, you can bring them down. Let's just check your side bends, trunk rotation, and toe touch. All right, are we still feeling that tension there, or still good?
Not on the left, no.
Not on the left. Probably because of the tapes.
Right. Tapes.
Okay.
Yeah.
Was it still tighter going to that left?
No.
No? And let's check out that toe touch.
Wow.
Still pretty good?
Still pretty good.
All right.
Yeah.
The other thing I tend to do here, we're gonna take a little pause from this camera. I want you guys to see one more slide that I want you to see here. If you guys are looking at this other slide, field expedient assessment, what am I going to assess? First thing is I say baseline gait, which is walking, or Romberg's test, which is a balance test, which we're going to do right now. I'm going to look at her balance. Remember, the saccules are responsible for keeping you upright. If I see any shifting, one of these saccules is not working well. Place the headphones in standard listening position, play 100 hertz, that's exactly what I have, bilaterally, both right and left. And then I'm going to repeat her balance. I'm going to check, is it a little more stable or not? Then I'm going to switch it to, I'm going to play with some frequency sounds. Then I'm going to switch it to either left or right ear and see which one gave me the best, which frequency sound and which ear as well. So now, let's go back to this camera right here. We have baseline, we already saw, range of motion. Let's see now Romberg's testing. To be a little bit more specific with this, do you mind taking the shoes off?
Yeah, sure.
Excuse me. Preferably with shoes off on this one, because I don't want you guys getting proprioceptive input from your shoes. For this one, we're going to have feet together. All right. Feet together. First of all, I have the athlete standing in this position with eyes open for about 10 to 15 seconds, and I'm just looking at a sway. And I'm seeing some shaking, right? It's not like full on stable. Now, I'm going to tell Laura, don't do it yet, Laura.
Okay.
I'm going to tell Laura now to have her eyes closed. Now, what I should see first, if I start seeing her swaying, I'm looking at where does she fall onto first? Let's say she might sway first to the right and then stays to the left. I'm looking at the initial sway. All right.
Okay.
So now, ready for this?
Mm-hmm.
Close eyes. And I see left. Yep. I see her leaning to the left. What do you think?
Mm-hmm.
Right?
Mm-hmm.
To confirm this now, I'm going to have her eyes closed again. I'm going to give her some perturbations. Right?
Mm.
If I hit her to the right and I see that she sways a lot further and has a hard time returning back to the middle, the problem's on her left side, her left vestibular system. If I hit her on the left side and she's falls onto the right a lot further than the other side, it's the right side problem. So look what I'm talking about. Eyes closed. I'm right behind the athlete and I go. Mm-hmm. One more. All right. If you guys saw that, every time I hit her on her right side, it took her, she bent to the left, but it took her a lot longer back to midline. Whereas when I hit her on the left side, I hit her and right back in the middle. It's not her right side judging by this test alone. This tells me something may be going on with her left vestibular system. So I like to hope that her sound is going to be mostly on her left ear. But let's see. I don't know. I got to test it out. So now, let's go feet a little bit apart. And I'm going to play now 100 hertz. Volume is loud but comfortable. And she's going to hear it on both ears. And it's set at 60 beats per minute. Right?
Okay.
You hear that sound?
Mm-hmm.
Now, because these are not touching well, why don't you just hold them gently with your hands and check your side bending. How did that feel?
Mm-hmm.
Not so good?
It's pretty good.
Pretty good?
Mm-hmm.
You can let go now as long as you're getting some vibration stimulus.
Oh, yeah. I feel it.
Let's check your rotations. Okay, check toe touch.
Mm-hmm.
Tighter, looser than before, still good?
Still good.
Still good.
Still good.
Let's check out that balance now.
Yeah.
All right, whenever you're ready, eyes closed. Still some sway, but it's not biased to the left anymore, which is pretty good. Now let's keep your eyes closed. We'll do some perturbations. Let's see what that does. Yeah, that's a lot faster. Yep. One more. That's actually pretty good.
Wow.
Now, let's just keep on trying a few things. Let's see what happens if I put it now 200 hertz. So I'm going to switch the frequency to 200 hertz, still both ears, at 60 beats per minute. Does that sound differently?
Yeah, higher pitched.
Trunk side bends again, rotations, toe touch. How did this one feel?
Feels better.
Better, right?
Yeah.
Yeah. Toe touch?
Yeah.
A little bit better?
A little bit better.
All right. 300. Check again. Oh. I think that was a little further.
Mm-hmm. That's farther.
It is further, right?
It's farther.
Toe touch again. Oh, yeah.
Yeah. Yeah.
Better, right?
Yeah. That's
Okay.
the best one.
I can go again 400, 500. I'm going to keep it to 300. But just for time's sake, I'm going to keep it to 300. Now let's see if I switch it on. Oh, actually, sorry. Under time. I'm going to also, so you can still hear the sound, right?
Yes.
Let's do the Romberg's test again. Feet together, eyes closed. I just want to make sure that she's solid. Ready for this?
Mm-hmm.
Ah. Now the right side got bad, right? I kind of expected that because she needs one ear more than the other. So now I'm going to switch it on her right side. You hear it on the right?
Uh-huh.
I can't wait for this. Let's do first trunk, side bending, rotations.
That's good.
Still all right?
Mm-hmm.
Let's see the hamstrings though.
A little tighter on the
A
hands.
little tighter.
Mhm.
All right. And Romberg's test. Eyes closed. Let me just see with normal stance first. And she's still falling left. Oh, yeah. Okay, now keep eyes closed. Let's do some perturbations. Ready?
Mm-hmm.
Nope. Right side's better, but not that left side. So now let's switch it to left ear. Trunk again.
Oh, past
That
my
one
knees.
further. Still good on that. Not did anything feel tighter with this?
Not tighter.
Okay. Let's see the toe touch now.
Widen my feet. Oh, much better.
Much better.
Yeah. Mm-hmm.
You're not kidding, right?
No, that
Okay,
was much
you
better.
can be honest.
Oh, yeah.
And last one, Romberg's test.
All right.
Let's see. Let's just keep you there. That is the most stable I've seen so far. That is the most stable. So now let's do some perturbations. Let's just confirm it. Ready?
Okay.
Yeah, that's the most stable. I can smack her and she's still staying there. Pretty cool.
That's very cool.
To end all this now, she has a vestibular stimulus. I minimize the threat to her lower back. I put tapes on it, minimized it even more. You see, this is how I treat every injury. This is how I teach everything on my NeuMove mentorship. Our job is to find possible threats. One of her threats into her brain was a bad vestibular system. Another threat was a bad herniation. Another one was a bad, I don't know, eyes or heel, whatever. I have to solve all these key pieces to the puzzle to make sure I leave this patient with the most minimal amount of pain as I possibly can. So now these are called stacks. I'm stacking something with the vestibular system, and now I'm going to stack movement drills. In her case, her isometrics. Let's make her really, really good now. Let's do it again. We have left foot in, right foot out, knees bent, hike up left hip with a posterior tilt.
Okay.
All right. And this time, let's get more specific. I want you more bent over, not full way.
Okay.
I'd say about right there.
Okay.
Okay. Hands together.
Okay.
And I'm going to do now yielding isometrics in multiple directions. Push to the left. Don't let me beat you. Don't let me beat you. To the right. Don't let me beat you. Elbow straight if you can. There you go. Don't let me beat you. Don't let me beat you. Push up. Don't let me beat you. Don't let me beat you. Don't let me beat you. Push down. Don't let me push you. Don't let me push you. To the left. Don't let me beat you. Don't let me beat you. rest. That is it. And I'm going to shut off these headphones. One final reassessment. Oh, they're already off. Nice.
They are now. Yeah.
Okay. Were they playing what
Yes.
Okay.
Yeah.
Just want to make sure.
Yeah.
Everything. Trunk. Yeah. Yes. Yeah. That's the best one.
Oh, wow.
Perfect.
That's the farthest on the right. Yeah.
Toe touch. Please give me something good. Ugh. Oh my God. Yes. 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 All right.
Look at that.
All right. Let's not aggravate it.
I haven't been able
People
to do
feel
that.
so good and they just stay there. I'm like, all right, that's enough. It's just a little quick assessment.
Wow. Okay.
But that was by far the best one, right?
Yes.
Perfect.
Wow.
Right. Thank you so much.
Thank you.
I'll
Yes.
call you later.
Okay.
All right. So hopefully this was helpful for you guys. That was bone conduction headphones, right? We played a little bit around with the frequency sounds. We played with which ear she needed to hear it the most. And I always have this with people because they always say, all right, I'm listening to this sound, and you put it on the good ear and they feel so much better. They constantly do these reassessments and then they automatically tell you, well, it's because I've been warming up and doing all these movements. That's why I feel looser. Okay. Let me put it on the opposite ear and notice how tighter you got. And then they see it. Oh, wow, I just got tighter. You see, I'm not talking shit here. This is all evidence-based stuff, if you want to know about evidence-based, right? So, postural, position-specific isometrics and bone conduction headphones combined, right? There's so many things you can do with your isometrics. I could have had Laura do isometrics while at the same time I can give her pelvic circles. So I'm giving her motor control, mobility, while she's doing isometric, while she's listening to the sound on her ear, while she's got tapes on there. So these are stacks for me to give one exercise, right? I personally like to leave my athletes and my clients with maybe 2 to 3 exercises, and that's it. But the most effective, it's what we call minimal effective dose, the most minimum amount of work, but the most effective. Because I know some clinicians give 7 different exercises for the lower backs and they're still feeling like shit, right? So stacking stuff that's my jam right there, all right? So that was bone conduction headphones. I pick isometrics first because athletes, they don't feel safe doing, let's say, crunches or Palloff pressing. They feel kind of scared doing that. Isometric work in multiple directions, in different body positions, is what I initially give to people with acute to subacute, even to chronic low back pain. From there on, I'm then going to progress them. I'm then going to put them in different lunge positions, doing isometrics. I might give them band work. I might give them vision drills at the same time. I stack other things for progression, or I need to regress. I might give so many different stacks in one drill, but I see the client now getting worse and worse and worse. I'm like, up. I can't load that anymore. I'm going to keep it to what gave you the best result. Hopefully that makes sense. Next question.
Can I try pulse device vibrations on certain points? Have anything similar? Stimulate some kind of nerve? Or are only these headphones that?
Beautiful question. So the question about, can I use the pulse device instead of the headphones? No, because you have to hear the sound. That's what matters. It's not just the vibration. You have to hear the sound because sound is vibration, right? So no, you have to use the bone conduction headphones. But I love the pulse device, which are these little pods that vibrate. I may not put it behind my ear. It's going to be very hard. But what you can do, if you have SI joint pain, I would put those pods, those sticky pods, on your lower back. And before you even turn them on, check your range of motion, check your pain levels, whatever. Then press play on a vibration. but all you have to do now is play with the intensity. Have it, let's say, at the lowest intensity where you can lightly feel the vibration. See if that makes it better. Still nothing? Increase it about halfway. That's a lot better. Awesome. Now put it on full on intensity. Starts to get stiff. Keep it somewhere in the middle. So to answer your question, no, you do need the bone conduction headphones because you have to hear the sound, and the vibration has to be very specifically placed on the skull. It has to be on the temporal side as well as the temporal mandibular joint. You have to have two of them. And you have to hear the specific frequency sound. The pulse device doesn't give you a sound, it's just vibration alone. And it's not the same. You can't, on the pulse device, you can't really measure exactly the amount of frequency you need. Plus, you need 2 pods on each ear. I don't think you want to do that. But I love the pulse device for other situations. Yes?
Question for Marissa. Could these potentially be helpful for POTS patients as well?
POTS.
In terms of helping to improve their symptoms with position change.
Absolutely. So POTS, thanks, Marissa. POTS is postural orthostatic tachycardia syndrome. Basically, it's a very complex case, very complex. But yes, the bone conductions definitely do help. POTS, guys, is for people that have this little syndrome. It's actually quite, it's kind of scary. That the moment they get up, not just get up fast, but the moment they turn or just get up from a seated position, their heart rate goes skyrocket. Their blood pressure goes up and they start feeling kind of like vertigo, right? Vertigo, though, doesn't have the tachycardia aspect of it. It doesn't make the heart rate go too fast. It does, but not as much as POTS. But yes, implementing bone conduction headphones to POTS patients, I'm not saying it's going to fix them entirely. POTS requires different breathing strategies like air hunger, rhythmic breathing. They do need a lot of visual drills as well. And I have to train their vestibular system a little bit more carefully. Like I have to check out what speeds of squats can they handle. I have to check out, do they need to dive deep down fast and slowly back up, or does it produce their symptoms? Conversely, if I drop them down slow 5 seconds and I have them go up fast, and if that makes them better or they doesn't produce any symptoms, I tend to use that type of squat motion to make sure that they're staying safe. Then I have to check out which position of their head. Do I have to have them in a left head tilt or a right head tilt? There's a lot when it comes to POTS. It's not an easy fix, but yes, the bone conduction headphones can greatly affect their symptoms. Maybe not overall, but they can get a reduction in symptoms a lot. So it's definitely worth it. But to answer anybody's question, my answer to everything is it depends. It depends on a lot of factors. Hey, Andreas, can we implement this exercise or can I give that stimulus? It depends on your reassessment. I can't tell you if it works or not. You have to test, do the drill, retest. That's neurology. There's no such thing as protocols. There's principles. Please understand that. All right. Do we have any other questions before I go on? We're good? All right. Now, before we go on to talk a little bit about this awesome deal, I want to bring in one of my students that I currently have of my NeuMove mentorship program. His name is Pierre. He's, I would say, a little advanced into the mentorship program. And I wanted him to come on because I want you to hear a little bit of his story when he started working with me. And Pierre, if you don't mind, can you just give me a little bit of a history of how did you find this mentorship program? What's your profession, and how did this impact you? To what kind of level?
Pierre is a mentee of mine. Been here for about a year and a half. So Pierre, why don't you tell me a little bit about your story and your experience as a physical therapist, not as a mentorship mentee,
Yeah.
but as a physical therapist, your background, where you work right now. Tell me a little bit about it.
Okay, hi, everybody. I'm Pierre. I'm French. I study physical therapy in Belgium. I got graduated in 2017, so it's been about 9 years since I'm a licensed physical therapist, and I'm living in Switzerland right now. So I started working as a physical therapist in Switzerland. I went to three clinics. Then I went to the hospital to work and just to see how it goes over there. And I have now built my own clinic. I work as a physical therapist, and my partner work as a personal trainer. So it's been 3 years on my own now, and it's my experience of physical therapy was very frustrating because I didn't have the result that I wanted. I didn't have the right interaction that I wanted with my patients, and it was a pretty frustrating experience. I've been following you, Andrea, since it's like 10 years, I think, on Instagram. Really, back when you were in New York doing scrapping and stuff with the bodybuilders, and you opened the mentorship. It was a big relief for me, and I was like, this guy is the guy, so I need to invest in his mentorship. And in this period, which is 1 year and a half ago, I told to myself, this is the last certification slash mentorship that I will have. And then if it doesn't go right, I'm gonna quit physical therapy and start working. I don't know.
It was that bad, just that you were at that wit's end that you were about to quit the
Yeah,
profession, right?
yeah.
Yeah.
I tried to quit the profession like 4 times in 9 years. Yeah.
Yeah.
So I actually quit for a year, and I did life coaching for a year. You know, it was pretty good, but I missed something.
Yeah.
So I get back to physical therapy, and um, and then yeah, made you invest in mentorship, and now my experience of physical therapy is totally different now.
Yeah.
I
Tell me a
improve.
little bit about that. How did it help? What did you
So
see in your practice?
in practice, what changed is really the how I see things now. I'm not limited now by the stuff that I can do. I'm limited by the system that I work in. That's why I'm building stuff on my own online now. I'm not afraid now to run out of things that I want to try with my patients. Right now, my biggest limitation is the time because I work, in the system.
Yeah.
But once I'll get out of the system, it will be better financially. It will be better because I will choose how much time I will dedicate to my patients. And since I invested in your mentorship, um, I was at like 55, 60% success with my patient, and I'm now at 80%,
Wow.
80, 85%. So
85.
it's a big jump in 1 year and a half. It's a big jump,
Yeah.
and I'm very happy. I'm
Good, good.
happier. I'm happier than before.
Happier.
I'm happier
You
than
feel like
before.
you feel
Yeah.
like you don't want to quit your job anymore, right?
No, that's not something that I
Yeah.
think of. I'm now in a total different direction now, and I want to build something rather
Right.
than quit something.
And with this mentorship, has this kind of opened up your eyes to other options as far as treating people? Meaning, you used to be more of a, you know, with no disrespect, but with as most therapists, they're very too biomechanical,
Of course.
a lot of tissue work. And would you say that this was something that gave you a lot more options to explore and to treat a lot more tougher cases where you would think that you would never be able to treat? kind of a thing?
The first thing that I can say is that it's been a year and a half, 2 years that I had not do a massage, which is good because I don't
Yeah,
like it, and
yeah,
I don't find having a result with it.
yeah,
Um, I'm not afraid to take uh, harder cases right now,
yeah,
so it's pretty good. And then it's right that you say that I was very biomechanical. If it hurts somewhere, I will only treat this region.
yeah,
Now I have more option right now. Yeah,
yeah. And with the mentorship now, with the content that's in there,
yeah, yeah.
would you ever think that how vision impacts movement, vestibular system impacts movement, visceral, breathing? Have you ever seen or been in been in a position where you were thinking that kind of stuff that can be a possible cause to an athlete's low back pain or something like that? Like, has it ever crossed your mind in the past before this mentorship?
Not yet. No,
Yeah.
no.
And have you seen like really good connections between all these other systems, how it affects people's low back pain or any kind of pain? Have you
Yeah,
seen how it impacts all that stuff?
yeah,
Right?
of course. I see it every day now.
Yeah.
Yeah, I see it every day
Very good.
now. Yeah, yeah, yeah,
Yeah,
of
yeah.
course. Yeah.
Um, 1 second. Yeah, so with this mentorship, as you can see that, we've taken an approach where we're not just thinking only biomechanics, but we're thinking neuro biomechanics or more multi-system biomechanics, multi-system approaches. Um, have you ever, even before this mentorship, noticed how vision impacts movement and pain, or your vestibular system, or breathing, your respiratory system, your visceral system, cranial nerves, things like that? Have you noticed how much those things that I've been teaching through this mentorship, how much this has impact your profession, but as most importantly, how it's impact the patient, right? Have you seen anything like this before?
No, not really.
Yeah.
No, not really. I never thought this kind of stuff was possible right now.
Right.
So
Right.
it's really, really, really cool to see that all the systems that we learn in the mentorship can be
Yeah.
applicable to the patient. But I never thought it was possible. Yeah.
Right. And you see that you don't necessarily have to send a patient to a specialist if they have like a vision problem or a vestibular problem. Do you find that this mentorship kind of makes you more of like a all-in-one type of therapist this time?
Yeah, yeah, of course. Totally.
Yeah.
Totally.
Very, very good.
It's really relieving to me that when a complex case come to get treatment, I can assess visual, I can assess vestibular, I can assess scars, I can assess skin, I can assess cranial nerves. It's really, really relieving to me that I can assess those things and give some patients exercise to go about it. Yeah.
Very good. Wait 1 second.
Yep.
All right. And so thank you for that. And last one, what about the the organization, the content of the mentorship? Let's take that one. Was it easy to understand, very simple to apply, or was it too
Yeah.
medical terms or anything like that? Was it easy to
Yeah.
understand?
The thing is cool about about the mentorship is that you have the ability to explain very complex stuff and in a very simple manner. So it's
Yeah,
really, really simple to understand. I like it a lot. I like it a lot.
yeah.
And regarding the availability,
Oh
what's
yeah, tell me about the support. Yeah,
yeah, the support in the mentorship is very cool because I feel like we are part of a big family and we can discuss cases, simple cases, complicated cases on Telegram. It's pretty
Mhm.
cool. I can text you or text the other guys, and I have a response in during the day. So this is completely, this is a game changer, really. It really
Thank
changed
you.
me. It's really changed my life, of course.
Oh, that's great. And
Yeah.
also the coaching calls that we have,
Yeah.
I'm assuming those are also quite helpful too. Do they provide additional support to you that you're seeking for?
Yeah, of course, every day.
Very good.
And I'm also learning about every other guy's cases.
Yes,
It's not
yes,
just
yes.
my cases. It's just
Other
if
people's cases.
all the people ask questions, I'm
Yeah,
learning also a lot with the other questions.
yeah. And that kind of prepares you also for like if I ever have a patient like that, I kind of know what to do already from now,
Yes.
right?
Yeah. Yeah. Of course.
Perfect, perfect.
Yeah.
So
Yeah.
overall, this mentorship has been something that has been a positive thing in your life. Would you say that has impacted you in a way where your business has also improved your skill set, but also your psychology? Like you feel just happier, you're not willing to, quit PT anymore, right?
Yeah, I mean, I would say this is the only mentorship that I took that has really changed my life in different level, financially, uh, physically, because you helped me also with my pains. Um, I'm more confident when my patients also. I am building my online practice also, so it completely changed my life and give me a really good direction
Excellent.
to invest my time in. Yeah.
That is nice, man. I'm very happy to hear that. Good.
Yeah.
Well, thanks so much for that, bro. So I'll be seeing you on future coaching calls, all right? We still got work to do.
Thanks, man.
All right, man. Thanks, brother.
That was Pierre, longtime student of mine, and he still currently is. And the reason why he's also still currently my student is because I just keep on learning more and more things about neurology, and I just want to keep on sharing this kind of stuff. And that's why I want to end today's webinar uh, with a really awesome deal that I have for you. Like I mentioned, if you are interested, you do not have to be a physical therapist. You do not have to be a physician. You can just be a normal fitness enthusiast. Anybody. I just signed up one of my good friends who's a programmer, has nothing to do with fitness, and he's taking the mentorship program because he's just interested in learning about this stuff. So for what I have for you guys, just to give you a little bit of a peek preview of how the mentorship looks like, we're going to start with a month long. You guys are going to have access to the first 2 modules. So as you guys can see here, risk-free, $50, and then you get refunded if you see that it's not for you. If it is for you, that $50 will be waived from the total investment that you're going to be getting out of this mentorship. So what else is what's going to be included into this mentorship? If we look at the screen over here, what you're going to learn: brain function and neuroplasticity. Neuroplasticity is a fancy word of saying a habit. When I have pain, I've created neuroplastic changes to stay in pain. That's another form of chronic pain. Getting out of pain, I have to create neuroplastic changes in your brain to stay out of pain permanently. So that's what we have to focus on, not just temporary results. I want long-term changes. That's why we have to learn the laws of neuroplasticity. If I have Laura doing these drills over and over and over again every single day, 3 times a day, even though it's just one exercise, but she does it for about, 50 hours of deliberate practice, meaning doing it every day, eventually that's going to stay permanent. That's what I like to hear, not temporary fixes, which, no disrespect, just like chiropractic care where you're doing your adjustments, crack, and then you're good to go. Doesn't work like that. What you're going to learn is also some movement assessment techniques, just like how we did Romberg's testing, right? So many different assessments, because the more assessments you have, the better data you have, the more you're going to know how to put the key pieces of the puzzle together for the appropriate rehab. You also have the respiratory system. So we're going to talk a lot about the breathing. Do I need inhalation-based practice? Do I need exhalation-based practice? Which of the two help my lower back the most? There's a lot of things when it comes to breathing. You're also going to learn motor control development and proprioception training, which is mobility, just like pelvic circles, neck circles. Everybody likes to they always ask me, can you do that thing with your neck? I'm like, all right, here it is. Neck circles, wrist, learning about how to move every single joint in your body, not just, oh, just this. Can I do complex movements? That is proprioception, right? Can I move every single joint from my little pinky toe to my little pinky on my hand, all the way up to my jaw? Oh, that is how you own your body, knowing how to mobilize joints without any other joint moving, right? So for example, if I were to do neck glides, right? That proprioception is, let me see if you can do a neck glide, and you're seeing that, or you're trying to do a neck glide and the whole body goes with you. This is a skill to develop. I have to make sure I have a stable spine while something above it or something below it moves. For example, stable chest, there, and in different positions, here or here. Nothing else moves except my neck, right? You'll see a lot of people that they'll always compensate. Learning how to disassociate is how you achieve full ownership of your body, right? So that's proprioception and motor control training. Materials and benefits that you're going to get out of this 1 month trial: full access to 1 month of the curriculum, 1 on-live mentorship Q&A call with me, right? Just like with the rest of my students. Usually it takes about an hour and a half long. So we're going to have a nice little Zoom call for those of you who are going to be in this trial. You can submit your questions and we're going to discuss this. It could be questions about the mentorship. It could be questions about your clients. Anything. That's what I'm here for. Access to student resources and course materials. I'm now shifting my entire mentorship program into school. And you guys are going to see the 2 modules there. And you can obviously submit your questions there, but you're going to have all the PDFs, all the PowerPoints, all the videos that I have, everything of demonstration videos, everything is pre-recorded for you. So you're going to have a nice little setup for each and every chapter. You're also going to experience the mentorship exactly as a paying student, right? I'm not going to treat you any differently. Decide, and then you're just going to come into the decision whether this program is the right fit for you, which I like to say that it is, because this is for everybody. This is not just for a specific population. So again, this is a $50 investment. So in your chat section here in the Zoom call, you'll find the link so you can register. And again, this is a refundable thing if this is not something that's for you. Totally fine. That's why it's totally risk-free. But why don't you try it? See how it feels? Get into the mentorship call with all the other students that I'm going to have in there. You're going to see the discussions that we're going to have. We're going to have a great time. So after this payment, please allow up to 2 business days for my team to be able to send you all the login credentials and access all the instructions that you need. So I think that was about it. Oh, yeah, just like last slide over here. We want you to experience the value of the NeuMove mentorship program with a full confidence. If you complete your trial and decide the mentorship isn't right, simply let us know and we're just going to refund your money back. This is virtually no risk, only the opportunity to learn, grow, and see whether the NeuMove mentorship program is something you want to use for your next steps. During your trial, you can explore the curriculum, attend a live call, submit your question, experience it firsthand. So basically, I'm just kind of repeating myself. And that's about it, guys. So thank you very much for taking the day, which we completed in really good time, for taking the day out of Father's Day to watch this. Hopefully this was very helpful for you guys. Before I go on any further, do we have any more questions, Santosh?
Yeah, just here offer to also answer questions if anyone else has about it.
Oh, yeah. And you guys can also contact Pierre, my student that was just talking a little while ago. He can definitely answer your questions as well. This mentorship program is also provided in the Greek language. As you guys know, I'm Greek, Andreas, it's a Greek name, and we just translated the entire mentorship into the Greek language. and we have coaching calls separately for my Greek students. We already have about 12, close to 15 students that are all physical therapists, personal trainers. I think one of them is a doctor, I can't remember. So we also have it in the Greek language. For those of you who are Greek and want to experience this in the Greek language, please let me know and we can talk more about it. And hopefully now with the help of Pierre, he's going to translate it very soon in French, because he's French, Pierre. He's going to translate the whole thing in French because he has a lot of people, a lot of therapists and chiropractors that are interested in what he's doing. And he just contacted me literally yesterday. He's like, man, can we do this in French so I can teach this? I said, absolutely. We can do it in German. We can do it in Korean. We can do it in anything you want. So hopefully we're going to be providing this in multiple languages. And now with the help of AI, we can possibly achieve that. So again, thank you all very much for watching. This was the NeuMove approach to the low back and SI joint rehab part 2. This will be uploaded on my YouTube channel. I like to say within a week from now. You're definitely going to be getting emails to view it again, as well as part 1. And hopefully I'm going to be seeing you guys in this 1-month trial period that we're going to have together for me to help you out. Thank you all very much for watching. You guys are the best. I will be seeing you soon. Take care.